What if the routine you've followed for decades is no longer supporting your body the way it once did? For many older men, no one ever explains that the body eventually needs a different approach. They simply continue with the same habits that once felt comfortable, often using more pressure, moving more quickly, and focusing entirely on reaching the end result. But after 60, your body goes through important changes, and your routine needs to change with it. What once felt completely normal can gradually contribute to irritation, discomfort, reduced sensitivity, and unnecessary frustration. When excessive pressure or friction is repeated over many years, it may place stress on delicate tissues and affect comfort and sensation in ways you may not immediately notice. That is exactly what we are going to address today. I'm Dr. Rose, and I've been practicing medicine for more than 7 years, with a focus on men's health, healthy aging, and intimate wellness. In this video, I'll explain how older men can adapt their personal wellness routine in a gentler, more body-aware way that respects the changes happening with age and supports comfort, confidence, and dignity for the years ahead. Before we get into the science, take a moment to like this video if you find the information useful, and leave a comment telling me where you're watching from. I always enjoy seeing how many men from different parts of the world are taking an active interest in their health. Now, let's begin with a question that many men quietly ask themselves but rarely discuss with anyone. Why can personal stimulation suddenly feel different after 60? I regularly hear from men who believe something must be wrong because their body no longer responds exactly as it did when they were younger. They may say, "Doctor, things used to happen much faster, but now it takes much longer." Or, "My sensitivity isn't what it used to be. Does that mean something is wrong with me?" Some even wonder whether a slower response means their natural desire is disappearing completely. But this is where an important misconception needs to be corrected. Aging does not automatically mean dysfunction. More often, aging means adaptation. Your body is not failing you, it is changing, and those changes require a different understanding of how your body responds. What worked easily at 25 may not produce the same response at 65, and that does not mean enjoyment or intimacy has to disappear. It simply means the process may become slower, more gradual, and more dependent on comfort and relaxation. Unfortunately, most men are never taught this. Instead, when their response becomes slower, they often try to compensate by applying more pressure, increasing the speed, or pushing themselves toward a particular result. That can create more tension and frustration rather than solving the problem. So instead of relying on old assumptions, let's look at what is actually happening inside the body. After 60, several important systems can gradually change, including hormones, circulation, and nerve sensitivity. Testosterone levels generally decline with age. That does not mean desire disappears, but it can make desire feel less spontaneous than it was earlier in life. You may no longer experience the same automatic urges you remember from your younger years, and in many cases, that is a normal part of aging. Circulation also matters. The small blood vessels responsible for supplying the tissues involved in sexual response can become less flexible over time, which may mean that physical responses develop more slowly or become less consistent, particularly when stress, distraction, or pressure is involved. Nerve sensitivity can change as well. Signals may take longer to register, meaning that sensations that once produced an immediate response may now require more time and a gentler approach. Biologically, these changes are part of the landscape of aging. Emotionally, however, they can be confusing because it may feel as though your body suddenly changed the rules without explaining why. Practically, this means the routines you relied on for decades may need to be adjusted rather than abandoned. And there is encouraging news. When men understand these changes and respond to them appropriately, many can maintain comfort, confidence, and a satisfying sense of well-being as they grow older. The goal is not to force your body to behave as it did decades ago. The goal is to learn how to work with the body you have today. So, Let's look more closely at the 5 common mistakes I see older men make with their personal wellness routine, and more importantly, how you can correct them. The first mistake is continuing to use the same amount of pressure you relied on when you were younger. When you were in your 20s or 30s, stronger pressure may not have caused any noticeable problems. But after 60, tissues can become more delicate, and excessive pressure may create irritation or discomfort. Using too much force can place unnecessary stress on small blood vessels and sensitive nerve endings, and repeated irritation over time may contribute to reduced sensation. From a biological perspective, repeated minor irritation can cause the body to become less responsive to the same type of stimulation. Emotionally, this can leave a man wondering whether he has somehow lost his natural sensitivity. In practical terms, he may eventually notice that the type of touch he became accustomed to at home does not produce the same response with a partner. That can affect confidence and create unnecessary worry. The better approach is simple: reduce the pressure and give your body an opportunity to respond naturally. Try a gentler hold and pay attention to what actually feels comfortable rather than assuming stronger always means better. The objective should be awareness and comfort, not force. The second mistake is moving too quickly at the beginning. As we get older, the nervous system may process physical stimulation more gradually. Rapid movement does not necessarily create a stronger response. In some cases, it can overwhelm the signals before your brain and body have enough time to process them properly. Think of it like tuning an older radio. If you turn the dial too quickly, you may pass right over the clearest signal. Slowing down allows you to notice what your body is actually communicating. Biologically, a slower and more consistent rhythm gives the nervous system time to respond and allows your brain to stay connected to the physical experience. Emotionally, it can reduce the feeling that you are racing against a clock or trying to accomplish something. And practically, it means building your response gradually instead of immediately trying to reach the strongest sensation. Give your body time to warm up. Allow the experience to develop naturally, and remember that there is no prize for finishing as quickly as possible. In fact, for many older men, patience can make the entire experience more comfortable and satisfying. The third mistake is overlooking lubrication. Many men assume that lubrication is unnecessary or that it is something only women need to think about. That is simply not true. As hormonal levels change with age, the tissues can become more vulnerable to dryness and friction. When that is combined with increased sensitivity or thinner skin, repeated dry friction can result in irritation, soreness, redness, or small areas of tissue damage. The biological purpose of lubrication is straightforward. It reduces friction and helps protect sensitive tissue from unnecessary stress. It can also make physical stimulation feel smoother and more comfortable. From an emotional perspective, eliminating discomfort can make the experience much more relaxed because you are no longer concentrating on irritation. Practically, a simple, unscented, water-based lubricant is often a reasonable choice for men who experience dryness or friction. Keep it available and use it from the beginning rather than waiting until discomfort appears. The goal is not simply to make the process easier, it is to protect your comfort and treat your changing body with greater care. The fourth mistake is treating the final response as a test that you must pass every time. I want older men to understand this because it can make a surprisingly large difference in how they feel about their bodies. As we age, physical arousal can become less predictable. It may rise and fall in waves, take longer to develop, or occasionally stop before reaching the outcome you expected. That does not automatically indicate a problem. When you begin thinking, "I have to make this happen," the experience can quickly become stressful. Stress activates the body's stress response, and that can interfere with the relaxed state needed for sexual arousal. Biologically, the nervous system does not respond well to constant pressure and self-monitoring. Emotionally, turning the experience into a pass or fail test can create disappointment, embarrassment, or even shame. And practically, the solution is to redefine what success means. A satisfying experience does not have to end in the same way every single time. Comfort, relaxation, connection with your body, and understand your own responses are all meaningful outcomes. When you remove the pressure to achieve one specific result, your body often has more room to respond naturally. The fifth mistake is ignoring the signals your body is sending you. After decades of following the same routine, it is easy to operate on autopilot. You may repeat the same movements, the same amount of pressure, and the same timing without actually noticing whether your body still responds well to them. But after 60, feedback becomes especially important. If something feels less comfortable than before, adjust it. If something causes pain or irritation, stop. If a particular approach feels comfortable and produces a better response, pay attention to that information. Your body is giving you useful feedback, and learning to recognize it can help you make better decisions. Biologically, paying attention to comfort can help you avoid repeated irritation and unnecessary stress on sensitive tissues. Emotionally, it can rebuild trust between you and your body. And practically, it means moving away from the idea that you have to perform in a certain way and toward the idea that you are learning what works for you now. At this stage of life, curiosity and awareness are far more useful than simply repeating what you have always done. So, what does a healthier and more comfortable personal wellness routine actually look like after 60? Let me take you through it in a simple way, because the goal is not to make things complicated. The first step is choosing the right moment. Don't rush yourself or try to squeeze everything into a few minutes. If possible, give yourself around 15 to 20 minutes of uninterrupted privacy so your nervous system has enough time to settle down. Your body responds better when you feel calm rather than pressured. Stress, rushing, and constantly checking whether your body is responding can make it much harder to relax. Think about creating an environment where you are not watching the clock or worrying about reaching a particular result. The second step is setting up your surroundings. This does not need to be elaborate. Comfortable lighting, a relaxed position, and even quiet background music can help reduce distractions and make it easier for your mind to settle. Remember, sexual response does not begin with physical contact alone. Your brain plays a major role, and when your mind feels safe and relaxed, your body is more likely to respond naturally. Before doing anything else, pay attention to your breathing. Take 5 slow, deep breaths and allow your shoulders, abdomen, and pelvic muscles to relax. This simple practice sends a useful message to your nervous system. You are safe, you are present, and there is no need to rush. Many men underestimate how strongly breathing and relaxation can influence physical response. When you are tense, your body is focused on managing stress rather than supporting relaxed arousal. When you breathe slowly and give yourself time, you create a better environment for your body to respond. Then, if dryness or friction has been an issue for you, apply an appropriate lubricant early rather than waiting until discomfort develops. Think of lubrication as part of maintaining tissue comfort, not simply something used at the last moment. Allow the tissue to remain comfortable and avoid unnecessary friction. This becomes especially important as the skin and other sensitive areas may become more delicate with age. Next, slow everything down. Instead of immediately focusing on the most sensitive area, allow your body to gradually become comfortable with the sensations. Think of the process more like a gentle massage than a race toward a finish line. Pay attention to different levels of pressure and different rhythms, but always remain within a range that feels comfortable. You are not trying to force a particular response. You are learning what your body prefers now. That distinction is important because your body at 65 is not exactly the same body you had at 25. It may need more time, more patience, and less pressure. If your level of arousal decreases temporarily, do not assume something has gone wrong. Pause, take a breath, relax your muscles, and allow the response to return naturally if it does. There is no need to chase it. The more you pressure yourself to immediately recover a response, the more difficult relaxation can become. Staying aware of your breathing can help keep your attention grounded rather than allowing your thoughts to turn into self-criticism. Your physical position can also make a difference. Many men never consider how posture affects comfort. Sitting hunched forward on a hard surface for an extended period can place unnecessary pressure around the pelvic region and may contribute to discomfort. Instead, choose a position that allows your body to remain relaxed. You might prefer reclining, lying comfortably on your side, or supporting your legs with a pillow. The important point is not that there is one perfect position. The important point is finding a position that reduces pressure and allows you to relax. If a position causes discomfort, change it. There is no reason to remain in a posture simply because it is familiar. Your comfort should guide the decision. And there is another option that some older men may want to consider: appropriately designed wellness aids. Products such as warming sleeves or textured devices are not necessarily something childish or embarrassing. For some people, they can simply be tools that provide a different form of gentle stimulation while reducing the need for excessive pressure. Think about reading glasses. Nobody considers glasses a sign of weakness because they help the eyes adapt to changing needs. In the same way, certain personal wellness tools may help some adults adapt to physical changes. The important thing is to choose products designed for adult use, follow the instructions, maintain good hygiene, and stop using anything that causes pain, irritation, numbness, or other concerning symptoms. The goal is always comfort and safety, not intensity. Now, there is another part of this conversation that may be even more important: knowing when a change should be discussed with a doctor. Not every difference after 60 is a warning sign. Many changes are a normal part of aging, but some symptoms deserve professional attention, especially when they are persistent, sudden, or getting worse. One clear example is ongoing pain, burning, or significant irritation during or after personal stimulation. These symptoms can sometimes be associated with inflammation, skin irritation, urinary problems, or an infection, and they should not simply be ignored. Another concern is sudden or persistent numbness. A gradual change in sensitivity can occur with aging, but a sharp or unexplained drop in sensation may require evaluation because nerves, circulation, medications, or other health conditions could be involved. The key is to notice whether the change is gradual and expected or sudden and unusual. Another sign worth discussing with a healthcare professional is difficulty achieving or maintaining an erection, even when you are relaxed and in private. Occasional changes can happen for many reasons, including stress, fatigue, alcohol, medications, or simply having an off day. But persistent difficulty may sometimes point toward vascular, hormonal, neurological, or metabolic factors that deserve attention. Sexual function can sometimes provide useful clues about overall health, which is why it should not automatically be dismissed as just getting older. And finally, pay attention to your emotional well-being. If shame, frustration, anxiety, or constant worry about sexual performance is beginning to affect your quality of life, that is also a valid reason to seek help. You do not have to wait until the problem becomes severe before talking to someone. A conversation with a urologist is not a sign of weakness. It is a sign that you are taking responsibility for your health and refusing to let embarrassment prevent you from getting answers. Even a short conversation with a urologist can sometimes provide the clarity you have been missing. A doctor can review your symptoms, medications, circulation, hormones, nerve function, and other possible factors that may be influencing the changes you have noticed. In many cases, simply understanding what is happening can reduce a great deal of unnecessary anxiety. And remember, you do not need to wait for a serious problem before bringing up these concerns. Preventive conversations are an important part of healthy aging. We regularly encourage men to discuss blood pressure, cholesterol, diabetes, prostate health, and heart health before those conditions become emergencies. Sexual wellness deserves the same level of attention. It is part of your overall quality of life, and there is no reason to feel embarrassed about discussing it with a qualified healthcare professional. Let's also address something that many men struggle with silently: the comparison between how their body responds today and how it responded decades ago. It is very easy to remember how quickly things happened when you were younger, and then become frustrated when your body takes more time today. But comparing your current body with your 25-year-old body is rarely helpful. Your circulation has changed, your hormone levels may have changed, your nervous system has matured. Your medications, sleep patterns, stress levels, physical activity, and general health may all be different. Expecting exactly the same response can create pressure that your body simply does not need. Instead, think about your current health as a new chapter rather than a failed version of the past. The goal is not to recreate your 20s. The goal is to understand what allows your body to feel comfortable and respond well today. This is also why slowing down can be so valuable. When men stop treating the experience as something that has to happen quickly, they often become more aware of the signals their bodies are providing. You may notice that certain levels of pressure feel better than others. You may discover that relaxation matters more than speed. You may realize that a comfortable environment makes a noticeable difference. These observations are not signs that you have lost something. They are information. Your body is essentially giving you a new set of instructions, and your job is to listen. Instead of asking, "Why can't I respond the way I used to?" ask, "What does my body need from me now?" That change in mindset can remove a great deal of unnecessary pressure. There is another important point here. Healthy sexual function does not exist in isolation from the rest of your health. Your heart, blood vessels, nervous system, hormones, sleep, physical activity, medications, and mental well-being can all influence sexual response. That is why a change in this area can sometimes be useful information rather than something to hide. For example, circulation problems can affect erectile function, while certain medications may alter sensitivity or desire. Poor sleep and chronic stress can also influence hormone levels and nervous system function. Conditions such as diabetes can affect nerves and blood vessels as well. This does not mean that every change indicates disease. It simply means that persistent or unusual changes deserve to be considered in the larger context of your health. For that reason, I encourage men over 60 to look at the bigger picture. Stay physically active within your abilities. Maintain a balanced diet. Keep your blood pressure and blood sugar under control if your doctor has advised you to do so. Get enough sleep, manage stress, and review your medications with your healthcare professional if you notice changes after starting or changing a prescription. These habits may not sound directly connected to sexual wellness, but they support the same systems that your body relies on for healthy circulation, nerve function, energy, and overall vitality. There is no single technique that can replace good general health. And please remember one more thing. There is no need to feel ashamed of normal changes that come with aging. Men are often taught to measure their health by performance, speed, and consistency. That mindset can become especially frustrating later in life. But your worth is not determined by how quickly your body responds or whether every experience ends exactly as expected. Your body is not a machine that must perform on command. It is a living system that responds to hormones, emotions, circulation, sleep, medications, relationships, and countless other factors. Giving yourself permission to slow down and adapt is not giving up. It is actually a more informed and healthier way of caring for yourself. So, when you put all of these pieces together, the message becomes much clearer. Personal wellness after 60 is not about forcing your body to behave as though nothing has changed. It is about adapting with respect and understanding. It means reducing unnecessary pressure, slowing the pace, paying attention to comfort, using lubrication when appropriate, relaxing your body, and listening carefully to changes in sensation. It also means understanding that satisfaction does not have to follow one rigid definition. Some days your response may be stronger, other days it may be slower. Sometimes you may not reach the outcome you expected, and that does not automatically mean something is wrong. What matters most is how your body feels, whether you are comfortable, and whether there are persistent changes that deserve medical attention. Your body is not broken simply because it has changed. It is evolving, just as every human body does throughout life. And with the right adjustments, many men can continue to experience comfort, confidence, and a meaningful sense of sexual well-being well beyond 60. In fact, becoming more aware of your body can sometimes lead to a more mindful experience than you had when you were younger. When you stop rushing and stop judging yourself against an outdated standard, you create space to understand your body instead of fighting against it. That is the real goal. Not trying to become the man you were decades ago, but learning how to care for the man you are today. So, let's bring everything we discussed today together. After 60, your personal wellness routine should not be about forcing your body to perform exactly as it did when you were younger. It should be about adapting with patience, awareness, and respect for the changes happening inside you. That means using less pressure, slowing your pace, paying attention to comfort, and allowing your body the time it needs to respond. It also means letting go of the idea that every experience has to end with the same result. Your body is not broken simply because its responses have changed. It is aging, adapting, and giving you new signals that deserve to be understood rather than ignored. When you listen carefully, make reasonable adjustments, and avoid unnecessary irritation or pressure, you can support your comfort and confidence for many years to come. Remember, getting older does not mean giving up vitality. Small changes in how you care for yourself can make a meaningful difference in how comfortable and confident you feel. And if you notice persistent pain, sudden numbness, ongoing changes in erectile function, or emotional distress that is affecting your quality of life, please speak with a qualified healthcare professional rather than trying to solve everything on your own. Your health deserves attention at every age. If today's information gave you a better understanding of what your body may be experiencing, take a moment to like this video. It helps this information reach more men who may be quietly dealing with the same questions. And if you haven't subscribed yet, consider subscribing and turning on notifications so you can continue learning about men's health, healthy aging, prostate wellness, circulation, and sexual well-being in a clear and respectful way. Most importantly, remember that asking questions about your body is not something to be embarrassed about. Understanding your health gives you more control over your decisions and helps you know when a normal age-related change is simply something to adapt to and when a persistent symptom deserves professional attention. And before you leave, there is one more topic you should know about. Even when you are taking a thoughtful approach to your personal wellness, certain everyday habits may influence prostate health and urinary function over time. Many men never think about how their regular routines may interact with their prostate, especially as they get older. That is why I have another video prepared for you that looks more closely at the relationship between frequent personal stimulation and prostate health, what current medical understanding can and cannot tell us, and which signs should encourage you to speak with a doctor. If you want to understand the bigger picture and learn how to protect your long-term health without unnecessary fear or misinformation, watch that video next. Take care of yourself, stay informed, stay hopeful, and remember that healthy aging is not about pretending your body has never changed. It is about learning how to work with those changes wisely. I'm Dr. Rose, and I'll see you in the next video.